searing nerve pain like sciatica can ruin your day, and it can really ruin your life. I spent the last 15 years of my career learning how to fix sciatica and fix it for good. So with just this 5-step routine, it'll take less than 10 minutes. You can completely rid yourself of sciatica within days. Let's get right into the video. The first thing that we have to go through is, where is the sciatic nerve and where does it get pinched off? So up here would be the spine. This is the leg right here. Up here at the spine, there's a bunch of branches that come out, and that's our first pinch point. There's a lot of pinch points down the leg. When I pull the glute off right here, you'll see this sciatic nerve running down right here, and that's where a lot of people feel it, right there in their glute. You get that searing pain when you press down on the ground, you put weight on that leg and it starts to light you up. That's a pinch point. And when we're doing these rollouts, the front end of these 5 steps, the first 3 steps are all about loosening up that nerve. We don't want to be directly on the nerve. I'm going to show you this lacrosse ball right here. I don't want to push directly on this nerve. It's going to aggravate it. I want to be off to the side, loosen up that muscle tissue. Think about if I have this as my sciatic nerve. It's a really thick sciatic nerve right here. But if it's right here, if I'm tight on this side, it's pulling and compressing that nerve. I want to loosen up the side so that nerve can glide around. So I want to be around the nerve, but not directly on the nerve. Now, looking further down the leg, we have that sciatic nerve running right underneath the hamstrings, and then I'm gonna twist this to the side and you'll see that it's running right underneath the calf right here. So on the front end of this, what we really wanna focus on is those pinch points. We wanna loosen up that sciatic nerve, get it moving so it can glide around, and we'll do exercises where we're using the correct muscles, but we're also working on movement patterns so we don't pinch it off again. Step number 1, we want to loosen up the hip flexors so that we stop pulling our back into extension. So we call this the samurai suicide. If you've ever seen any old samurai movies, it's called seppuku, where they kill themselves because they are disgraced. They're a disgraced samurai and they go, oh, and they kill themselves. So that's kind of the angle that we're going at. So what I'm going to do is I'm going to lay down and I'm going to spend a minute on each side. So I'm finding my pelvis right here. It's like a bowl, and I want to be on the inside of that bowl right here. So I'm going to find the edge of the pelvis, come right on the inside of it, and then I'll put pressure down and out into that, and I'm going to hold it. Just taking deep breaths. When you're doing this to yourself, I want you to stay between a 3 and a 5. I want it to be uncomfortable, but bearable. And so now I'm gonna comb this and just glide into that pelvis and loosen up this muscle. This is a game changer. Very rarely are you gonna find online quality information on working on this psoas muscle. And most clinicians won't work on it because it's really hard on your hands. It's like, but this is a very important muscle that we have to work on. It's a linchpin in our rehab when we're fixing the sciatic nerve. So we absolutely, if you're at your house and you're working on this, you can use a broomstick, you can use a Theracane, you can use one of these rolling pins. It's just anything that can give you a not so sharp, so a dull edge, but digging in, down and out into that muscle. Now I'm gonna switch to the other side. You may have sciatica on one leg, but we wanna work both sides because when we're moving around, so this one's more tight on me, more tender, and so I'm gonna spend a little bit more time. So I'm gonna spend 1 minute on each side, but the one's a little bit more tender, I might give it an extra 30 seconds to make sure that I get a lot of loosening right there. The reason why we work on both sides is that we always have reciprocal motion. So when I'm walking, my right leg being able to do what it's supposed to do will dictate my left leg being able to do what it's supposed to do as well. So we got to always work on both sides. Now, the pelvis is our primary focus. When you're going down into the hamstring, which is step number 2, we're gonna roll out the hamstring. We're gonna loosen up that hamstring. Then anything at the pelvis, we wanna work on loosening up, making sure that we loosen up those muscles around the pelvis on both sides. When you get to the single leg in the hamstring, you can just do the one side, just to save more time, right? So step number 2, I said it was gonna be the hamstring, but I actually wanna stay at the pelvis. So what we do with step number 2 is I'm gonna get over here on the wall. So I wanna be right here on my glute, and I'm loosening that up. Just like what we were talking about, the sciatic nerve's running right here, but there's a corkscrew. We got 4 muscles overlapping right here, so I wanna put my ball right here at my belt loop, and I'm gonna get sideways against the wall, and then I'm gonna unweight this leg. This is the first step. So I'm gonna show you step number 2, which is a progression, is on the table or on the floor, is that I'm gonna get out of that crack right there. And then now I'm gonna push it off to the side. We're always compelled to lift up our hips and slide this under, but then we're directly on the sciatic nerve, and that's gonna be counterproductive. So what we're gonna do is I'm gonna put this off to the side right here, and then I'm gonna roll my body, my shoulder, my arm, and roll into it. So I'm staying stacked in my chest. I'm rolling into it, put my hand underneath my head, and I'm just breathing and relaxing right here. I'm loosening up those glute muscles. So I'm gonna do that for about a minute. One movement, what I don't want you to do is wiggle through your back. So a movement that we can do is just wiggle that leg up and down, just gliding around, and you'll feel where it gets tender. If that's not getting it very tender, it's not making it tender, which most of these are. We start standing, once that doesn't hurt anymore, we got the superficial layers. Then we go to lay down on it. And then the third is where now I'm laying down on it, but I'm putting this leg up. So I'll put this leg up over the other knee, and then I'm gonna roll into it. Now I've made those muscles tight, so it's gonna be a little bit more aggressive. So remember, we're staying between a 3 and a 5. Uncomfortable, but bearable. I'm gonna set up on the other side. On this one, I definitely, now that I've done it for a few weeks, I'm gonna be doing it a more aggressive way. And so, but I'm always keeping my chest and my pelvis stacked over each other. We call that the central canister. We want to make sure that we're keeping our chest and our belt buckle stacked. And when we do that, we're keeping good alignment for our diaphragm and our pelvic floor. And all that stuff, if you're following our videos, make sure that you hit the subscribe button, like, and leave us a comment if we're not clear about something. But this is the front end. We'll get out of sciatica. We'll get to where we're feeling better. But we have more videos that we're going to share with you on exactly how do we get rid of this for good. And that's what we want to do. From the comfort of your own home, you can fix sciatica and make sure that it's gone long term. But this programs, they build on each other, and we have progressions to them. And I want to make sure you're getting the best out of it. Step number 3, we're gonna go into the hamstring. So let's say my sciatica is on my right side. If we have it on both sides, we wanna do both sides. Both sides is better typically, but just to get a little bit more timely with it, I'm gonna put this on my right hamstring right here where it bifurcates. So it's about mid lower hamstring. I'm gonna put pressure on it. I keep my back in a neutral position right here. So I'm gonna come to the side so you can see it. So my back stays in a neutral position. I'm on the outside of the hamstring. I'm gonna show you exactly what I'm talking about right here on this model. So I'm gonna put this right here. I'm gonna put it in the middle, in between the two, up a little bit higher, and then on the inside right there. And so I'm gonna do what I call 10 swipes. So I'm coming right here. I don't need to get the leg fully straight. I just need to get that muscle gliding underneath me. If I want a little bit of extra pressure, I'm gonna put my hand down on my leg, and that really makes me start feeling tender right there. So I go 10 swipes where I'm just gliding up. So 10 extensions with the knee, and then I'm gonna go right to the middle. Now, if you go in the middle and you feel that nerve getting sparked, it's going down the leg and it's mimicking your pain, I want you to just stay on the outsides. Remember, we're not trying to go directly over the nerve. This has so much tissue right here, most likely you're not gonna be directly on the nerve, but I have had clients that it has been on the nerve and it has not been comfortable for them. And we don't want to flare this nerve up. We want everything to be productive. If you're having pain, we're increasing pain with any of our exercises, then we're doing them wrong, or they're the wrong exercises for us. Because when we increase pain, we're increasing inflammation, and that's going to slow down the healing process. So we got to make sure we're communicating about that. So leave a comment, let us know. We can give you some alternatives. Now I'm going to go on the inside, same thing, getting those 10 swipes. Just gliding right there. And I'm speeding through it a little bit. This is the pace that I'd want to go at. So loosening that up. You might not feel it as much up higher, so you might want to go a little bit lower. Right there, I feel it a lot more. So I'm just going to take my time loosening that up, because this is the most important thing before I do these exercises, is to make sure that that nerve has the ability to glide around and that muscles are not cinching it up and creating stiffness and tightness on top of that nerve. So now number 3 is 2 exercises. We're gonna grab a TheraBand and I'm gonna wrap it around my knee. We're gonna do a clamshell and a side lying leg raise. We gotta activate these glutes. So when I do my clamshell, I'm gonna lay down to the side and then I'm gonna roll forward. So my chest and my belt buckle are stacked right here. I'm gonna roll forward with my hip and my shoulder and chest. I want my top knee to be about 2 inches in front of my bottom knee, and then I'm gonna tighten in my tummy and I'm gonna lift that knee up. I'm gonna hold this for 30 seconds. This is an isometric, a sustained hold. I'm just holding it. Now when I come up, my belly stays tight and I don't wanna roll back or I'm gonna be using a different muscle. So I stay in this position. Now when my leg comes up, it's about even with my bottom knee. So right there, that's about 30 seconds. I'm gonna take a 10-second break. And then now, same position, rolling forward, tightening the tummy, and then I'm gonna kick my leg back, and I'm gonna make sure I don't wanna do this. Watch what happens to my back. I don't wanna get my back involved. That's gonna cause me more problems. So I gotta stay tucked in my tummy. I'm pushing up and back with this leg, getting as much of a contraction in that glute as possible. And I'm holding that position, making sure that I'm not rolling back. That'd be a problem. So I'm keep that belly tucked, squeezing, doing 30 seconds. I'm gonna do a 10-second rest again. Catch my breath. Roll, tuck my belly, hold that up. Anytime, if we don't have a tight enough band, I always want you to band up and do a little bit tighter of a band if you find yourself trying to create tension and rolling back. That's counterproductive, it's gonna slow us down. So we always go with a little bit heavier of band with less range of motion. We need to move less. So I'm tighten. Okay, now my 10-second rest. And then now I'm going straight out again, squeezing in the tummy, rolled forward a little bit more. In the middle of this one, I'm squeezing my glute, checking to make sure everything's firing well, but I want you to be thinking, hey, I probably rolled back unintentionally, so we're gonna roll forward a little bit more and kick the leg back a little bit more. Last 10 seconds, holding that, squeezing that, pushing it up and back, roll forward a little bit more, tummy tucked, good. I'm gonna rest. If we have it on both sides, then we're gonna work it on both sides. But now step number 5, we're gonna do a hip hinge. So our hip hinge is where we're getting that nerve to glide and we're primarily working our hamstrings and our glutes. So I'm coming right here. I'm gonna move this table a little bit so you got some space to see me. So I'm coming back like this. My face stays in line with my chest. My lower leg stays vertical. I'm right here. I'm going to measure my foot length. If you have smaller feet than me, you measure your foot length. We always measure our foot length away from our barrier. Typically we do it against the wall, but I'm gonna show you on the table right here. My lower leg stays vertical like we're going camping, like the stake being driven into the ground. And so that stays totally vertical. I reach back with my butt, my chest comes down. This is not a squat, it's a hip hinge. So a squat would be like this, and now I'm cranking in my back, especially if my head's up. So we're gonna change that movement pattern. We gotta make sure that we're going backward and forward. So I'm going backward with my hips touching, forward with my hips. Backward with my hips, forward with my hips. Really helps when people say, sometimes they say like sitting on the toilet. If that's how you sit back on the toilet. It's good. If I really say, sometimes in women's classes, they say like blossoming the butt. I really like to think about it like I'm trying to rip the back of my shorts. So I'm really pushing my butt back in the back of my shorts. Some things that we see where people mess up with this is that initially when they start to move back, they do this. So their back is leading the motion. And that's a root cause. That's the reason that we're having this problem. Is that if you're struggling with it, I want you to just get closer to the wall or to the table or to the bed or whatever you're doing it to. Just get a little bit closer and then make it a shorter motion. Just there and coming back up. Shorter motion. We're gonna do 15 of these, so I'm even coming closer. Short motion, so I'm touching, the back of my leg's touching right there, but you can see my lower leg stays vertical. My back and my chest, they're not moving. I'm not extending at all. I'm allowing my chest to come down, pushing my butt back, now pushing my butt forward. And this is a great exercise. We should be doing it every day. With this program, we need to make sure that we're doing all 5 of these steps twice a day. Within a few days, you're gonna be feeling great. So make sure that you hit the subscribe button, leave us a comment so we can give you the best videos, the best content of exactly what we do in the clinic. What I see is there's a huge difference in people posting videos when they actually work with clients versus people who only post online. We have 7 clinicians here, 4 personal trainers. We have a 94% success rate, up from a 92% success rate the year before. We measure our success on our clients hitting their #1 goal and being happy that they came here and worked with us. And we're in Houston, and I know we're the best clinic there is in the entire country because I do business coaching and learn about other clinics and what their systems are. So if you've really been struggling and you're going to the doctor and they're saying you need surgery, we've had 8 back surgeries in the last 9 years and over 1,000 back pain and sciatica cases. This is fixable. You just need the right information, and we got to have consistency with it, and we'll get you there. So follow us, like us, subscribe us. We'll see you in the next video. Have a great day.